Today on Heartbeat, we'll be tackling the abortion debate. I'm Arlana Shikongo, and I'm joined by two medical doctors who are on opposite ends of this argument. With me today in studio, I have Dr. Nelson Makemba and Dr. Gloria Behr. Thank you for joining me. As we know, the abortion debate has created two camps in this argument. We have people that are for the legalization of this procedure to allow people to deliberately terminate a pregnancy. And then, of course, we have the people that are vehemently against it. It has become a subject of a lot of cultural conflict because it tackles various beliefs, be that moral, religious, legal, psychological, and scientific, of course. So I think to get us started with this conversation, Dr. Makemba, can you explain to us what an abortion is and what the methodology of the procedure is as well?
Thank you once again for having me on the platform. All right. By definition, what abortion really is a termination of pregnancy before the mother is actually able to give birth. Oftentimes in our settings, we do it at least up until, for instance, 24 weeks in settings where it is legal. And then it can either be deliberate or medically indicated. In other words, deliberate meaning that a lady is now pregnant and she's not so sure whether she wants to continue the pregnancy, and then she chooses to terminate. And then, of course, it can also on some ground be medically indicated, where maybe a condition has been identified that is deemed not to be compatible with life. In other words, maybe a SONA is done, and there's gross fetal abnormality such that if this child is carried to term, which is 9 months, and the mother is able to give birth, the child might not necessarily live long or might not lead a normal life, or might just maybe, take a first cry and then demise. So those are the ground on which termination or abortion can be conducted. And of course, there are quite few methodologies. And also the methodologies are dependent on the size of the pregnancy. A woman can either be given tablets that will help her expel, whatever, the product of conception that is, especially if it's small. It can be done via manual vacuum aspiration. Other parts of the world, they also use what we call electronic vacuum aspiration. They can be taken into theater. We do a dilatation and evacuation, a dilatation and curettage. Those are by far the methodologies that are employed in, conducting the procedure.
Okay, so you mentioned that usually this procedure would be conducted before 24 months, no? Which is about 24 weeks, which is about 6 months.
Yes.
Now, a lot of this debate comes to the morality of the life that is growing in the woman's womb. A lot of people contest whether even a 24-week-old fetus can be considered a life. So I just want to discuss that a little bit. Dr. Behr, I'll throw that question to you. A fetus of 24 weeks or less, is that considered a human being?
Yes, indeed it is, because the question is always posed to doctors, when does life start? So life is a series of developmental stages, okay? So you cannot ignore the first part of life, which is intrauterine, starting from when the sperm meets the ovum at conception. So people like to ignore that part and say life starts at birth, when the child takes the first breath. But then how can anything start and ignore the first part? So for all practical purposes as a doctor, life starts right at conception. I know many lawyers will say, no, life starts when the child is born. So we develop from a fetus. When we are born, we are called a baby, then you are infant, then you're toddler, teenager, and you go on till you're an old person and you finally die. So that is how life develops. So I believe all life belongs to God, and He has plans for that life, and that life has purpose. So life starts at conception.
Dr. Makemba, would you agree with that, that life starts at conception when the egg meets the sperm?
Yes, basically, if you also just look into medical research, of course, advanced and developed centers have done a lot of studies in terms of looking at the fetal development intrauterine, where mothers are followed up with all kinds of scanning, including 3D scans, and the developmental stages has been monitored. Scientists and medical practitioners as we are, we have actually, gotten to a greater length of understanding fetal life. And these little things in the womb, they are able to express emotions. They are able to cry, funny enough, They can actually pick up on their mother's emotion. So it's literally a full developed human being. It's just that, the stage of life is such that, the body is still growing, so that it's able to come to a point where it's able to live outside the uterus. But, if you look at it, even scientifically, it has proven to us that, right intrauterine, that life is already demonstrating, all kinds of human life that, we all live outside. Yeah.
Arlana, this is a 12-week fetus.
This is to size, no?
To size.
Okay.
You can see 2 eyes, 2 ears, nose, mouth.
Okay.
All the limbs are there. If you turn to the back, there's a backbone. Okay. So at 19 days of conception, after conception, there's a heartbeat. But on our sonars that we have currently in our practices, we cannot pick up that heartbeat. But it needs an intrauterine sonar device to follow that. But that's when there's already a heartbeat. We can only pick it up transabdominally at 8 weeks. So 8 weeks and 19 days, 5 weeks apart, basically. So life starts right when those 2 cells meet. When they start dividing into 2, go to 4, go to 8, that's life. I spoke to one of my patients just before I came, and she said something very simple that everyone can understand who's never been to med school. She says, doctor, if I go buy a pregnancy test and I test myself, if it's negative, there's no life. If it's positive, there is life. As simple as that.
Perhaps then, I think a little known fact and a misconception, because I think a lot of people try to position life in terms of a heartbeat or brain activity. And perhaps many people don't know that already after this few amount of days, there is a heartbeat. No? So essentially that's where the premise of it is a life comes from. But then when talking about the life of the fetus, that then leads into the discussion of the life of the person carrying that fetus. And how does the life of the woman and the life of the fetus compare to one another? So in your profession, when you deal with women that are pregnant or women that are struggling to come to terms with their pregnancy, what considerations are made for that woman in the instance that she's not ready to be a home to a life?
Right. Let me just look at it and maybe discuss based on clinical experience. You see, that's why the aspect of reproductive health education is very important. And I think oftentimes this is where especially our system might have failed, especially our young ladies. I think they need to be educated on reproductive health so that then they stand a better chance of making better choices. And of course, going forward, looking at the consideration of the mommy that is pregnant. Most of the time, the aftermaths that oftentimes is not spoken about. If a woman do decide to go ahead and terminate the pregnancy, just simply because she feels she's not ready. The psychological impact she has to live with, the guilt conscious she has to live with, all that come back to us as clinicians. And then assuming worst case scenario, this very same young lady that terminated at 21 is now happily married at 30 and is not able to conceive and fall pregnant and give her husband a child. She's now in front of me. Doctor, I feel so guilty. What if that was the only child God wanted me to have? Now, all of these things, the world outside there doesn't see. But we as clinicians sit with these headaches, and we have to counsel people. We need to, try and find alternatives to help them. And then, of course, sometimes, the worst case scenario, the only alternative left, for instance, is IVF, which is also a very expensive procedure. So it is indeed, a topic of debate, and it's indeed, something that, women need to know about, their rights, their bodily rights, their right to pregnancy and everything. But of course, for me, really, I think, we ought to do a very excellent job in educating our young ladies so that they make right decisions at the right time, and then they do not find themselves between a rock and a hard place.
Absolutely.
Yeah, so many times you advocate the right of the child that she is carrying, because at the end of the day, you're not just doctor to the mother sitting in front of you. You're also doctor to the child who cannot speak for himself. So you really try and make this person also take in an account that the choices that she makes is now not just affecting herself, it's also affecting the unborn child. And sometimes if you just spend enough time, because you come to doctor's office and it can become very busy. And I always say just that 5 more extra minutes just to hear out what is actually the anxiety behind the pregnancy. Is it the fear of my parents find out? Is it the fear of being condemned by my peers? Or, just taking more time and speak to that person, send to another counselor who's actually trained to speak in depth with the person. Sometimes it's just that extra little bit of time. Then the person can realize, no, it's not so bad, the situation that I thought I want. Some people even come to the extent where they say, I'd rather kill myself than want to speak to my parents. So it's not always just that they are facing abortion. They're also facing suicidal notions, so you really have to take time and counsel and most probably also refer to a psychologist or another counselor to speak in depth.
And doctors, you make a very, very important point that for the women as well, the process of, first of all, making the decision that they want to have an abortion is not an easy one. It can be a very traumatic one with, a lot of other things at play when making such a decision. With that said, though, considering the difficulties a woman faces in making that decision, considering the extra thought she has to put into the life that she is now also carrying, wouldn't the legalization of this procedure facilitate these processes, Dr. Behr, as you mentioned, sending them for counseling, psychological treatment? Wouldn't those things be put into immediate effect so that somebody has access to those things on an easier scale than they do now? Granted that women are already having abortions, but the method of getting to that point is not safe because of the legalities surrounding that. What are your thoughts on those particular difficulties with this process?
Arlana, you will find that, for instance, the background in which me and Dr. Behr trained in South Africa, like we were saying offset before, that they have a system because it's legal there. And they got a clinic called TOP, Termination of Pregnancy Clinic. Now, just to set up this whole program of TOP in itself, it's not just something you legalize today and tomorrow is up and running. Because it will then mean that you need to set up centers in different, hospital settings. It also means that you need to train nursing staff. It also means that you might have to have psychological counselors that are specifically trained for these, services, particularly these services alone. So you are looking at a very costly exercise as well. Of course, it will run into millions of dollars to set up a service of this nature. And then, of course, even if you have the money to set up that kind of service, then the aftermath that we have spoken about also. Because some young ladies will make this decision thinking it's a simple decision. And then the very same young person that was that had made up her mind a week ago, comes back to you 2 weeks later, and they feel horrible. And they are telling you, doctor, I wish I had listened to you. And then also you now also have to help this person, because if they don't get properly counseled, the whole act of having done it and now feeling guilty can push this same person over to becoming suicidal, and if not properly followed up, can even become go ahead and commit the act. So I do hear what you're saying. All I'm saying is that the whole approach, it's a very lengthy approach. It's not just something that we could say tomorrow the powers that be and the legal system and instrument have decided is going to be legal, and tomorrow it's up and running. Every lady has access to a clinic and it can be done. So there's a lot of behind the curtain work that goes into this kind of things, and it's not an exercise that you just wake up tomorrow and decide to establish.
Yeah. Even in South Africa, where you can get a legal abortion up to 12 weeks, and if it's medically reasons, then they go up to 24 weeks. It hasn't stopped illegal abortions from taking place. At the same time, in a country where it's now legal, you have these pop-up doctors who've never been to university, call themselves Dr. Zulu, and they advertise on the lamppost. We will do a termination up to 9 months. So that woman is still falling in the hands of that person, So at the end of the day, we're really not winning this situation by legalizing it. Because if you go to South Africa, you'll still find women losing their wombs because of septic abortions that were not done properly in a clinic. So at the end of the day, I don't think this is the answer. I will go with doctor and we say, educate people, educate people. You cannot lose by educating, and safe practices. Everybody's talking about rights, bodily rights, pregnancy rights. I would like to know what these things are. Because at the end of the day, moral rights, the word moral refers to the one who has authorship. So who has authorship over your body? It's only your creator. So what rights are we talking about when we talk about moral rights? Is it morally right to end in a pregnancy? You are confronted even as a doctor with those questions, whether it's according to the act that we practice on, the Sterilization and Termination of Pregnancy Act of 1975, we're still acting under that one. So we have 4 indications where legally you can ask for permission to terminate pregnancy. And you sometimes read these things and you wonder, is this right? Yeah, so I'm also sitting with questions.
And of course, even I remember very well back in the days when I was, of course, still under training. You will be with the gynecologists, that are guiding and training you. And the worry has always been, in fact, you find some young girls are now using termination of pregnancy almost like a contraceptive form. The behavioral pattern is, not kept anymore. The people, they would go and just do what they want to do, and then of course knowing that either ways, if I fall pregnant and I don't feel like keeping it, it's as good as just walking into that clinic and then flushing it down the toilet. So you sometimes end up with a youngster who has been to the clinic up to 3, 4, 5 times a year.
Yeah.
And then, of course, that already predisposes this person to developing other complications such as excessive bleeding and even ending up with a hysterectomy, which is basically removal of the whole uterus. And I mean, just imagine now you are a young lady, you have fallen pregnant a couple of times in the year, you have terminated a couple of times, and now you have the complications where you are either excessively bleeding or, like what Dr. Behr said earlier, you can end up with an overwhelming infection, then it's called septic abortion, and then nothing can be done to save you except cut out your whole uterus. When that happens, it becomes now a nightmare because there's no way of you ever becoming a mother. And these are the kind of challenges I think that, of course, people that are not necessarily in the medical fraternity don't get to see. they don't also get to think about, because you wouldn't really know because you are not trained to think that way. But we sit on this side of the fence and we sit with these realities. Because now I have a lady with a septic abortion or that is excessively bleeding. We tried everything to save her, but we can't. And then now we tell her, we are sorry, we have to take out your uterus. And that's it. And now you find the very same young person, as I've said earlier, that I've given an example. Now maybe we do this at the age of 21. Now you are 30 years old. You are more matured, you have a stable career. Now you have a young gentleman next to you that loves you so much and desire to start a family with you. The moment you tell them, but my uterus has been removed when I was at 21 years old, now you have to explain to him why was it removed. And now there's a possibility that this guy would also walk away from you. So I think we need to balance out the education aspect, really, in my opinion, because then it helps our young ladies make better choices.
There are a number of things from both doctors that I want to come back to and address a little bit. Dr. Makemba, I'll just quickly start with you, since it's one of the last things that you said. Talking about recurring incidents of a woman having an abortion. I don't know if such figures would exist for Namibia, but perhaps your knowledge of the statistics in South Africa. How often does something like that happen?
It's very quite common, to be honest. And of course, given their population, they are quite bigger than us. But we, in my training, I've been to those clinics. I have not participated, but I have been to just see what's happening. You sit with the nurse, they will tell you, that one again. A few months ago she was here. And then that one again. A few months ago she was here. So in places and countries where they have legalized, the reality is it is happening. My fear, though, is if, for instance, people were to consider legalizing such practice in our country, we probably will run into the same problem. And of course, the problem then comes because once you make a service available, you make it public knowledge, people, they do not think about consequences. They just know if anything happens, I can go to Katutura, I can go to Comasdal Clinic or whatever clinic, and I can just flush it down the toilet. But then they do that, they go back to the same behavioral pattern again because they are not empowered to make better choices. And then a few months down the road, they will be back to the same clinic again. And at some stage, a complication is bound to happen. Excessive bleeding, infection. Like I said, a uterus is removed. And now you are just a young person. You just thought, I was just getting rid of it so that my mom or dad doesn't get to know. And then the next thing, you end up with your uterus removed. Going forward, you are condemned not to fall pregnant ever again. So I think one really need to be very cautious in how we address, knowledge dissemination, how we educate the public. These are some of the stuff like, perhaps people, layman people wouldn't even know about, that you could end up losing your uterus. In fact, you could actually end up dying from this procedure. If it's not done properly, if the complication is overwhelming and you report late to the health facility, you could get an infection, it becomes so systemic, you get into a septic shock. By the time you get to the hospital, it might be too late. So then you end up losing both the life of the mother and the baby. Of course, this is worst case scenario, but it can happen.
And what is shocking about opening abortion clinics is that a child of 14 can go in there and demand an abortion. And she can legally sign, which is very strange that only at 18 you can sign to have a consent procedure, a medical procedure, but they give you authority in your hand to sign at 14 over your sexual rights, your reproductive rights, and terminate a pregnancy. And you don't have to inform your parents. So there's already a lack of support for that young lady. She's not going to find the support in the abortion clinic, number one. She doesn't even inform her parents. If she doesn't change her behavior, because this is a child, and we do not know how she felt pregnant, because she cannot give consent to sex according to the laws that we use in Namibia. Now South Africa has changed the laws that they say a child of 12 can give consent to sexual intercourse, but all along At 14 you could not, because that's why we had a law of statutory rape. You could have prosecuted somebody. And now with this setting up abortion clinics, you change everything to accommodate that. But you're not looking after that 14-year-old child, because the first time she came was already a problem. You did not fully counsel her, because then she would never have come back. But like Doctor said, they come 2, 3, 4 times in a year, because the behavior doesn't change. Nobody should return if this clinics was successful in what they say they are offering. Nobody should return. I don't believe a child should ever come back there. If you're 14 years old and you come back 14 and 3 months later, then somewhere there's something not addressed.
And then that leads into what I was going to ask next, on the idea of, first of all, accessibility. Dr. Behr, you talked about earlier how in South Africa, even though there has been legalization, women still go, to these backdoor pop-up doctors. A lot of times it's because they probably cannot afford the legal procedure. No? So accessibility could potentially be one issue, and I want us to expand on that. And then second to that, potential of regulation. So speaking specifically to the idea of returns, women who return and have multiple procedures. I know that, for example, with Plan B, when you go buy Plan B in a pharmacy, there's a number of times that you can buy that in a year. Of course, there are loopholes. You can go to different pharmacies where they don't necessarily know you. But in thinking of the framework of legalization, wouldn't legalization create room for better regulation? Systems that can monitor who is coming, when they came, of course kept confidential, like a patient list is kept, so that if somebody returns 4 or 5 times in a year, rather than having a procedure every time, a doctor can look on some sort of program and say, ma'am, you had a procedure 6 months ago. Maybe the best course of action this time is to sit down and get you counseling or get you into a program. Does legalization not create potential for better regulation?
All right. I do hear exactly what you're saying. And I think from our perspective as clinicians, of course our career involves dealing with humanity. Human behavior is a very difficult aspect of life to manage. It takes a lot of time. Yeah. Even with access to education, knowledge and information, the message doesn't always trigger down as effectively, and at times it takes a bit of a longer time repeating the same information over and over again before it sort of, get to trigger down into somebody's behavior and changing how they live. Now, aspects of regulations, as you are saying, for instance, assuming a service of this nature is legalized in in Namibia. Now, clinics are set up all over. Now, this young lady is sitting in Keetmans, she has done it twice there, and now she realized, I think they are now getting to know me at their clinic. She gets into a Kumbi, she comes in Rehoboth, she does it twice there. Then now, I think they're getting to know me in Rehoboth. Next time, she gets into a Kumbi and she comes and do it twice in Windhoek. So already, that can potentially then become difficult for the system to pick up that this one is also doing it recurrently. Because now, she would just logically think that the nurse will remember I was here already twice. So to avoid being lashed at or being looked at with that eye, I will just go to another town altogether. Now that can potentially become a problem in terms of, setting up, regulations to then say if this person is rather coming as often, we then help them otherwise. That's a potential, challenge you could be faced with, of course. And once you legalize it, unfortunately, it's legal. So even if you're sitting with this person that is coming to you a 10th time,
it's legal.
The truth is it's legal. And you as a clinician, you are in a clinic, I want the service, therefore offer me the service. Even if humanity in you will then suggest that maybe let me help this person, If they want it gone and you have legalized it, unfortunately, you are now forced to terminate. So it creates all kinds of loopholes, really. Yeah.
Yeah. So accessibility. It is accessible, but what happened in South Africa, they can only do so many in a day's work, you know. So there were waiting lists, and people come late. So by the time they come, they are 14 weeks, and then they're outside the period where 12 weeks is the legal time and cut-off time. And then they now come there and they realize, but I'm 14 weeks and no one else is going to help them in the system now, in the legal system. So they are pushed to go to the backdoor doctor, you know. So that will always be a problem. There will not be, if abortion is legal, because it becomes a tool of contraceptive. And we must just name it as it is. Just like a woman can go to the clinic and say, I would like to have a depot injection, she has the right then to a legal abortion. So if the clinic system fail her, whereby they don't have space for her, she will then be pushed to go to the next best thing. And that will be the person without qualifications and who's just running a clinic in his backyard. You know, so legalizing this thing hasn't worked. If we look at the countries where it's legal, and we go and count how many women still continue going to the person next door without the qualifications, we will still find the same figures that we are finding today. You know, so when I worked in the state hospital, we find people coming in. Many times we recognize them. But at the end of the day, you are at the end of the spectrum as the medical doctor. You haven't done anything wrong that help an abortion. You are now just the medical doctor. The problem you are having in front of you now is the incomplete miscarriage. So even if that woman comes 10 times to Katatura Hospital, and you suspect that this is even an illegal abortion that is taking place here, there's nothing that protects you as a doctor that you can speak out. All you can address is the behavior of the person currently as things are. You can only address the behavior, but you cannot say anything or make suggestion or accuse the patient, because there's nothing that will protect you as a doctor if you say, but I think you are doing this and this. No, you can't say those words. You just have to deal with what is now in front of you. Try and save that uterus. Try and speak to the person and say, listen, my sister, this is not good what's happening here. You need to change this behavior. And people are not always open to talk to you about that, you know. So.
Yeah, and the challenge really, you find, for instance, in the setting that we are in now, like Dr. Behr said, everything that then present to the hospital is incomplete miscarriage. Because we know miscarriage do happen naturally. But now because it's not legalized, they will not present to you and say, look, I did something, but then something is left behind. And they become so good at presenting their history. They will say, look, I was pregnant, I was fine, I was happy. The next thing I just started bleeding. And then they present now to you. Now as a doctor, your only form of diagnosis that you are standing on is incomplete miscarriage. Even if you want to help influence human behavior, you can't now say, let's talk about abortion. Because the person will look at you and say, but why would you talk about abortion? Who has aborted here? Me, I was happy, I was pregnant, and I lost my baby. Why you want to talk about abortion to me? And then, of course, like Dr. Behr said, now the challenge with pop-up doctors in a legal system where the system has legalized this is that it actually gives them free leeway to do what they do. When it's not legalized, they are afraid they can get arrested. But when it's legalized, this guy will just be dishing out tablets and then telling everybody, once you start bleeding, run to the hospital. And then now you will have a hospital catastrophe over burdens. Because these guys will just be dishing out whatever they are dishing out. And then as soon as the women are bleeding, now it's legal, I can just walk into Katutura and say, hey, I'm bleeding, you help me.
Yeah.
As to who helped her to initiate the bleeding process, that's none of your business. It's legal, so I'm not obliged to explain much. I'm now bleeding, I want to be helped. And that can potentially put a lot of pressure on the health system. Of course, we are already in a financially constrained environment. Now just imagine you're having 20, bleeding ladies presenting on a daily basis to the hospital, and out of 20, plus minus 5 are having infection that might need to stay longer in the hospital, probably end up in ICU, that would need further, management. That can potentially put a lot of pressure on the systems as well.
Yeah, currently in Windhoek there are 2 clinics. I Google these things and I found these numbers, 081 numbers. Yeah, in Windhoek.
But they're not legal.
Nothing is legal. It's
They cannot
illegal
be
to
legal,
do
yes,
abortion.
yeah.
But these people advertise themselves on the internet. You call those numbers, they tell you very quickly, can you send me a WhatsApp? And they don't know who they are talking to. So, and then I ask, and how much are these pills? And what exactly are they? No, they are just womb cleansing pills. You will have to send me 2,000 rand. And they don't care who they are sending it to, number one. They don't care your medical history. They don't care how far you're pregnant. It is available. People are selling these things on the street. And anyone who Googles these things, they can get access to them. And they can get the pills, put it in, and they come to the hospital. And then you as a medical doctor, you have to rush and save a womb. So this thing is much bigger than just a law being passed. Because we're going to open a can of worms that we are not ready for.
So, doctors, thank you both so much for giving me some insight as to your experience and your position on the matter. What I'm drawing from this conversation is that with or without legalization, abortion poses a serious threat.
Yeah.
And that even as doctors, you are faced with the conundrum of having to care for a woman, care for the life in her body, and then also making conscious decisions that affect your own consciousness at a later stage. I think this is a discussion that we can have for hours, for years, effectively, as we have had them before, because people are on polar opposite ends of this. And one subject area we didn't necessarily get to dig into was the morality and the idea of sexual reproductive rights and bodily rights, right to your body and what you do with it, which can of course be a conversation for another day. I'd just like to take, before we wrap up, any final thoughts or any final commentary that you'd like to share with our audience from both doctors.
Yes, I think also from my side also, I would think if we don't also address the boy child in aspects relating to this, we are going to be doing a disservice to the subject. I think also educating our boys out there, it's very important, so that it influences their decisions as well, because sometimes we find young men also do put these young ladies into, put them in a corner, put them under pressure. And then of course when now things have happened and she's left pregnant alone, this boy child is nowhere to be found. So I think we also need to drive at educating young men in terms of sexual behavior in relating to their partners, and also being considerate and having to be there to be safe in terms of saving the integrity of the young lady they're involved with as well. Because by far most of the time when you find women that are confronted with the prospect of considering abortion, the man behind the picture who has gotten her pregnant is always nowhere to be found. Yeah.
I'm a product of a teenage pregnancy, and I'm grateful to be alive. I'm grateful that my mother did not opt to think of what society will think. I'm the second teenage pregnancy for her, second child. The one was just the year before me, and she's not married and come from a Christian home, and I'm grateful to be alive. because my mother could have thought, what would society say? What will the parents say? And she could have done something very silly. And today I'm grateful that I'm alive and my mother did not opt to abort me. And that is what I would take as a take-home message for all these people who are listening to this. For all of us who are alive, we should be grateful for the life that we have. And I don't think we should take the life from anybody else. Let's give this baby a chance, and we will be surprised who comes to this earth. And we do not know, is it the next president? Is it the next scientist? So let's give each one an equal chance.
Thank you so much, Dr. Behr, for sharing that with us. Dr. Makemba, thank you as well. This has been quite a discussion, various viewpoints and things to think about when we're thinking about this abortion debate. We were speaking to two medical doctors who have seen the devastating effects of abortion, have worked on the ground, have had to counsel women making this decision. And, you know, the perspectives, as I said before, the spectrum remains completely polar. And this is a discussion that we will continue to have on our platforms to make sure that all voices are represented and all the information is out there so that informed decisions can be made. I'm Arlana Shikongo, and this is the Namibian's Heartbeat. Thank you very much for joining us.